Hi, this is Jeevaratnam and welcome to my channel Jeevan Astro Answers. This topic is about fibrosis. The liver is a vital organ that performs hundreds of tasks related to metabolism, energy storage, and waste filtering. It helps digest food, convert it into energy, and store the energy until the body needs it. It also helps filter toxic substances out of the bloodstream. But if any injury in the liver may lead to liver diseases. Liver disease is a gentle term that refers to any condition affecting the liver. These conditions may develop for several different reasons. Some are caused by infection, others can be the results of drugs or drinking too much of alcohol. Some inherited conditions, long-lasting injury, or scar tissue in the liver, they all can cause liver diseases and damage the liver and affect its function. Liver fibrosis is one of the major liver diseases that cause morbidity and mortality throughout the world. Liver fibrosis is the excessive accumulation of extracellular matrix proteins, including collagen, that occurs in most types of chronic liver diseases. Liver fibrosis happens when a person is subject to an injury or inflammation in the liver. After a single episode of injury, the liver cells regularly stimulate wound healing. The liver commonly repairs itself by making new liver cells and then it attaches them to the web of connective tissues, that is internal structure. During this wound healing, excessive proteins such as collagen and glycoproteins build up in the liver. Eventually, after many instances of repair, the liver cells loses its ability to repair themselves, and these excess proteins form scar tissues, and it can alter the liver's internal structure and limiting the blood supply for the liver cells. Without enough blood, these cells die and more scar tissues get formed. And also blood pressure in the portal vein that carries blood from the intestine to the liver increases. and this condition is known as portal hypertension. And this blood pressure that it may also cause liver injury. Finally, they all may lead to fibrosis. Fibrosis can also develop more rapidly if there is any blockage in the bile ducts. And also, various disorders and drugs can repeatedly or continuously damage the liver and thus cause fibrosis. Some conditions and drugs that can cause fibrosis of the liver or an excessive accumulation of iron, Wilson disease, which cause copper to accumulate in the body, bile duct obstructions, chronic heart failure, autoimmune hepatitis, and some parasites and viruses that can also infect the liver and causing inflammation, which it may reduces the liver function. The most common types of liver infection are hepatitis A, B, and C viruses. Genetics also play an important role in case of fibrosis. An abnormal gene inherited from one or both of your parents can cause various substances to build up in the liver and thus resulting in liver damage. And the most common cause of liver fibrosis is non-alcoholic fatty liver disease, while the second is alcoholic liver disease due to long-term excessive drinking of alcohol. Non-alcoholic fatty liver usually occurs in people who have extreme body weight, diabetes or pre-diabetes, and or high levels of fat, that is lipids, and cholesterol in the blood. This combination of risk factors for fatty liver disease is often referred to as metabolic syndrome. Over recent years, metabolic syndrome leading to non-alcoholic fatty liver has become increasingly common throughout the world. But sometimes the cause of fibrosis is not known. However, within the liver, fibrosis can reduce overall function, including the purifying of blood, storing of energy, and clearing of infections. It limits the organ's ability to regenerate and also it restricts blood flow within the organ. If fibrosis left untreated, liver fibrosis may progress to cirrhosis of the liver, liver failure, and liver cancer. Unfortunately, many patients with fatty liver disease and liver fibrosis, they do not realize that they are having liver disease because The symptoms are often vague, like mild fatigue or abdominal discomfort. When liver disease progresses over time, patients may begin to experience a poor appetite, feeling weak, unexplained exhaustion, unexplained weight loss, nausea, vomiting, discomfort, or mild pain in the upper right abdomen, edema, jaundice, very itchy skin, increased sensitivity to medications and their side effects, problems with certain cognitive functions such as memory, concentration, or sleep. Now, we come to the medical astrology part, that is, the role of planets, signs, and houses for liver diseases. Cirrhosis is a disease caused by bile disturbance, and the responsible planets are Sun and Mars. Seat of this disease is Leo and Virgo, 5th and 6th houses. Liver and pancreas are ruled by Jupiter. When above planets, houses, and house lord are afflicted by malefics, by their conjunction, aspects, etc., the bilirubin in the body increases. Leo sign is a seat of liver and Jupiter planet is a Karaka. Sun, Mars govern bile and Moon is a ruler of blood. If Leo, 5th house, 5th lord, Jupiter, Sun, Moon and Mars are afflicted, it gives liver troubles. Fibrosis can sometimes be reversed if the cause is identified promptly and exactly. If you have fibrosis, you have to subject some physical examination and may go for blood test to evaluate your liver function. You may also undertake abdominal ultrasound, abdominal CT, body MRI, ultrasound elastography, magnetic resonance, or liver biopsy to help diagnose your condition. Treatment for fatty liver disease and or liver fibrosis depends on the underlying cause and is typically aimed for to preventing, slowing or reversing the progression of the liver fibrosis. Such treatment options include lifestyle changes, medications, cholesterol and diabetic management. But if left untreated, after months or years of repeated or continual damage, fibrosis becomes widespread and permanent. The scar tissue can form bands throughout the liver, destroying the liver's internal structure and impairing the liver's ability to regenerate itself. Such severe scarring is called cirrhosis. Liver fibrosis and cirrhosis resulting from long-standing liver damage represents a major health care burden worldwide. To date, there is no precise anti-fibrogenic agent available, and making liver transplantation is the only curative treatment for decompensated cirrhotic liver diseases. So, prevention is always better than cure. I hope you might have received some important information from this video. We will meet you soon in my next video. Till then, take care. Bye.